So before we begin today, I'd like to thank each of you for coming to this event. As you might be aware, MaterCare International receives no government funding or support. And so it's the individual citizens like you who support MaterCare projects that allow us to continue to serve women and their children. Thank you all so much for being here on this Friday afternoon. This is the first of our 2015 webinar series entitled MaterCare On-Air. We hope you find these discussions valuable, and we welcome your questions and comments at the end of the presentation. My name is Jennifer, and I'm the Social Media Director for MaterCare International. I had the pleasure of meeting Dr. Walley at a conference in Calgary, Alberta in 2011. After hearing him give a powerful presentation on MaterCare and the work the organization was doing to help mothers and promote the dignity of human life, I immediately wanted to get involved. MaterCare International simply would not exist without the dedication of Dr. Robert Walley and our project manager, Simon Walley, who are both with us today remotely from St. John's, Newfoundland. Dr. Walley, would you like to begin?
Yes, hi. Good afternoon. I'll add my thanks to you for tuning in. Just to say something about the fellow sitting next to me, I had the pleasure of meeting him quite a few years ago. And he's been working with me since 16 years. And that was not on my kind of suggestion. He applied for a job here when we couldn't find anybody to be involved with informing Canadians about what we do, because we're talking about maternal mortality and other ugly kind of subjects. And he'd grown up with this and had done a lot of work on it, I understand, when he was doing his degree in political science and history. So anyway, the board hired him, and he's been here for 16 years, which is a particular commitment to something like this where there's no security, but he's very useful. Anyway, I'd like to say hello, maybe good afternoon to you, or good evening, should I say, if you're really east and you're tucked up in bed watching this with your computer, or if you're a little bit further west, you might be in Europe and you might be in the afternoon. Here, you're in the afternoon in Newfoundland, or it may still be good morning for you if you're farther west. Anyway, let me just explain something about MaterCare. MaterCare means, obviously, mother care. The mater is the Latin word for mother, and care, obviously. And we were told to have a name that explains exactly what we do. And we couldn't use the word mother care because a big chain of baby clothes stores had the copyright to that. So we thought about the French for it and mère care, but they didn't have much of a ring about it. So we went to the Latin. The reason for setting it up came from the experience of people like me, colleagues like me, who qualified as specialists in the mid to late 70s, when the abortion laws had come into being. One of the first was the United Kingdom, where I lived, and we were bringing up our children. And I was applying for senior appointments as a specialist, and was told there was no room for me in the National Health Service if I was as a Catholic. And they gave me three choices: either do the abortions, change your specialty, or leave. And we left. And it was kind of painful, but it turned out to be the most best decision we ever made, because it's opened vistas that I would never have dreamed about in the United Kingdom. To be very clear about who we are, we're an international group of Catholic obstetricians and gynecologists. And the reason we are in existence, which might some people seem to be rather small, is because while I've been working in Newfoundland for some time, I suddenly, to my utter and total and complete surprise, got a letter from the Vatican on behalf of Pope John Paul II, appointing me as a consultant to the newly created Pontifical Council for Health, like a Vatican Ministry of Health. And when we had the first meeting, it was clearly said to us, indeed it was Cardinal O'Connor of New York, said, you know, the problem with the abortion issue is obstetricians and gynecologists, and something ought to be done about them. But he didn't say what. A number of my colleagues and I, as I said, had been discussing the fact that we needed to have an organization that represented us, that supported and encouraged us. And we started to look for colleagues who might want to join. But now the conscience clause was being denied, and everybody was under considerable pressure either to compromise or to change and get out. And the Holy See was very clear that they hoped for an international specialist group that would speak out on behalf of the church in its area of competence, but also get on and do something, not just to talk about it. So we're not a talking shop. So we began doing work in Nigeria. This is before MaterCare. I was doing it in 1981, 82. And then it was a slow gestation period before we got to 1997, and we actually created MaterCare International. And we continued to show that, develop a portfolio of accomplishment to show that mothers in developing countries in particular, because at that time, and still, there was an awful problem of the number of maternal deaths occurring, as well as those mothers who have obstetric fistula, which is an injury caused during obstructed labor, and the mother doesn't get a cesarean section. And there you see a picture of Grace wearing the veil, who I knew very well indeed. She was about 16. We looked after her, we encouraged her, she was treated, and she went back to school, and then she got into some trouble. But anyway, finally, the tragedy with her is that she eventually died of malaria. She was about 21. But she is the sort of person that we were dealing with. Anyway, we've continued to try and do other things for ourselves, like encouraging, evangelizing ourselves, and that's been done through a number of different conferences. We've had 9 so far in Rome with papal audiences on 2 occasions. The first one we held was in 2001, and Pope John Paul II, he asked to see us. It was arranged before we actually got there to Rome. When we got there, we were told it was on a Saturday. We went and saw him. There were about 100 of us. And he more or less said very clearly, look, I know how difficult it is for you. I know that you are under great pressure. You're being denied the right to conscience and so on. But he said, the church has never needed you. Mothers have never needed you so badly as they do now. And then, to paraphrase him, he said, please don't quit. Please don't quit. But he went on further to say, look, this is not your total responsibility. You need the help of the entire church, everybody, to encourage, support, and do everything they can to show that the church can be and remain so the largest provider of healthcare in the world, especially for mothers. So we've had projects in Nigeria, in Ghana. The present one is a very large one in Kenya, a place called Isiolo. And it's a place where we are trying to reduce the maternal deaths. We're in a place where it's probably the highest in East Africa. It's certainly the highest in Kenya, where mothers die mostly in the rural areas where they have absolutely no place to deliver. And so we had other meetings as well. We had one in Warsaw and one in Zagreb from post-communist countries where our colleagues were under terrific pressure, basically because the people who were running the hospitals were still the same communist management administration, who just changed their hats. And then we've had 2 in Kenya in the last 4 years. The idea of showing how one can be innovative in the way you provide healthcare and advice on natural family planning and so on. So right now we are trying to expand. We'd like to see somebody in every country. We have a meeting coming off in Rome, 31st of August to the 3rd of September. We hope we can get an obstetrician or even just a doctor to come from as many countries as possible. The theme is maternal health with a Catholic conscience. And we will have as much time as possible so that everybody who comes can give input, how we can further not just our own well-being, but the lives and health of mothers everywhere. That doesn't mean saying just in developing countries, but here in Canada, here in the UK, in the States, showing that we do have a place. And I shouldn't forget to mention that we can't function without midwives. We need midwives and obstetric nurses because we form a team. And then we need administrative support. We do need financial support because it's not just enough to talk about the abortion issue and so on. We've got to get on and tell people about what can be done better. We offer life and hope rather than death and despair. And I think Simon's going to speak to you now about the current project, Project Isiolo. Simon?
Hi, good afternoon, everyone. I'm just going to explain a little bit about Project Isiolo, and then I'll get into what our current position is, what we are doing over there currently now. But to start off, in 2005, we were invited by Bishop Luigi Licati from the Apostolic Vicariate of Isiolo to come over and see what we can do about the problem the problem that they have with the state of maternal health over there. They had a very high death rate over there. So we traveled over to Isiolo. We stayed there for a little while, and we got to see much of the vicariate. Now, Isiolo is right in the middle of Kenya, and it covers a very vast area. It's very dry. They've gone through periods where there's very little rain, and they've gone through a drought that for 6 years. But the vicariate also, they've already have a health network in place. So we went out and we visited various parishes, and we found that they didn't have much in the way of structures. They didn't have much in the way of equipment or even training. So we put together a needs assessment for the bishop, and that became the model of rural essential obstetrics. And we came home, and the bishop accepted it. We came home and we started to fundraise. One of the first problems we had right away was that the bishop was murdered several months after we left there. And right there and then, the project's on hold because we only work in partnership with bishops. So we had to wait for the new bishop, Bishop Anthony Makobo, who was put in place. And we went over there. He accepted the project as well. So again, we carried on and we started fundraising. So part of this model that we were going to do was various components of, first is providing emergency transport, because the road system over there is not very good. To travel 200 kilometers could take you up to 5 hours. And that's during the day with a very good driver, experienced driver. Nighttime is different. We were also providing emergency communication, and for Kenya, they use cell phones over there. Very little in landlines. I guess you could say they're more advanced than some of us countries in the Western Hemisphere. We were also we were going to train the traditional birth attendants, which account for 87% of deliveries in the villages. So we were going to train them to do clean, safe deliveries, and provide other programs for them, and teaching them nutrition, breastfeeding, and natural family planning. So, most of these TBAs are very, very intelligent. They've seen all the situations. So we were teaching them to identify the high-risk mothers, that as they near their due date, that they would be able to go down to the hospital or nearest clinic where they can get care very, very quickly. What we were also going to do as well, where they lacked any facility over there, is that we had to build a hospital that could provide the clean, safe deliveries and give a mother what we have here in our country. We also agreed that we would build a clinic up in Mirti, which is 200 kilometers away, where there's very, very little in the way of any healthcare up there. So we built a small clinic up there in 2010. That's now open and functioning, and we have a very experienced nurse midwife there who she has many, many patients that she has to look after, but she's done exceptionally well in saving a mother's life and even the baby's lives. In 2012, we opened up the maternity hospital in Isiolo, and that was so important to Kenya that the president at the time, President Kibaki, was there for the ceremony, for the opening ceremony. Sadly enough, there was a lot of ambassadors and high commissioners invited to this, of which one was the Canadian High Commission, and sadly that seat was empty during the ceremony. So where we are right now is the hospital's built, it's functioning. We have to put up several more buildings, several more support structures, and that's a laundry and kitchen. We want to put up an independent training multi-purpose center, and then we want to get into putting in a fistula hospital, and which would have the 2-bed operating room and ward. But that comes down to funding. That over the past several years, we've raised the money, not enough to do this whole project at once, but decided that we had to do something right away and broke it down into phases. So right now we're into phase 2, and that's where we currently are now.
Let me explain what the services we offer at the hospital. It's essential obstetrics. We call it the 91% solution. That means that 91% of all maternal deaths occur during the last 3 months of pregnancy, during labor and delivery, and a couple of weeks afterwards. This means obviously that those who are providing abortion and birth control are not doing anything. They're not helping the mother in any way, because these mothers are going to die unless they have essential obstetrics. That's the same sort of care that all of us get, all of our mothers and so on get in Canada. And the reason for not having that over there seems to me to be ridiculous. It means that you just got to go on and do it. And that means that, unfortunately, the government of Canada seems to be more interested in not in the 91% solution, but in the 9% solution, because they get a lot of money from Bill Gates to provide abortion and birth control services, which are contrary to the whole way the people think and that they act and what they need. The other thing is, it was very important that we take the hospital to the mother rather than the other way around. That's the reason for having what we call parish maternity clinics, where you can have a normal delivery. And the most important thing is prenatal care. And then you've got to have transport. We have a 4x4 ambulance to go long distances. And then, as you can see right now, we have a motorbike ambulance. And that motorbike ambulance can carry the mother, who might be in labor, or she might have a complication and so on. The nurse can sit on the back. There is an IV pole, a medical chest. She's got a place for carrying blood. And she has a driver on a kind of a mountain bike, because the roads all the way through are non-existent. If you want to get from Isiolo to the mother, it's 225 kilometers over dirt roads, driver beds, and so on. And on a couple of occasions, being shot at by people who are coming over the Somali border. So it's not easy. And you might say, well, perhaps you shouldn't be there. Well, that's the problem. Everywhere you see mothers these days, in crisis situations, they have to endure everything that everybody else does, guns and machetes and bush bullets and so on, and Ebola virus. But on top of that, they have to endure all the complications of pregnancy. You know, when a baby is coming the wrong way, when they have hemorrhage, when they have convulsions, and so on. Somehow you can't just put everything on hold in pregnancy. So right now, as you can see, we've built a very nice looking hospital, a nice ambulance that can carry the mother safely, and the equipment and the staff and so on. And this isn't extraordinary. This is just simple what needs to be done. And we're trying to show this as a demonstration project to the church, to the people of Kenya, but also to the people of Canada, so that they know what we're doing or where the money's going. We're doing this on a shoestring, so we need your help. Thank you.
Wonderful. I just want to, again, thank everyone for coming today. At the end of our presentation here, we're going to have a short Q&A. So I'm going to open the floor for that. If anyone has questions, you can do that by unmuting your microphone, or you can text us here in the left in the chat window.
All attendees are muted and may unmute themselves by pressing *6.
Do we have any questions today? We have a question here from Stephanie Potter. She says, I work with a pro-life group in Eastern Canada. How can I best promote your work?
By telling everybody that you know and around you, your pro-life organization, about what we're doing and who we are. We're small, but we have done a huge amount in the since 1997. We don't do enough work in Canada. We need to find our colleagues in Canada. We are doing so right now, but we need your help in contacting people wherever you live. Tell the pro-life organization, tell women's groups what we're doing. Tell your church groups about what we're doing. All of these things are very practical and are sort of counter-cultural, if you like, in the way the world is going. We're fighting an enormous battle, if you can think about who we are.
Ask the question.
Who we are actually having to deal with. So, you know, but so much can be done with much less than all the millions and billions that are being spent on the abortion birth control.
Just to add to that as well, what we've done in the past is if we can organize enough in a certain region, you know, if it's just going up the 401 in Ontario or going out to British Columbia, if we can organize various presentations that we will come up there. And, you know, normally we do this with air miles. People donate from across Canada, donate air miles. So, you know, one of the biggest costs there of travel is already covered. That we will go up there, we'll spend a week in a certain region, and we'll go around and visit the various community groups or women's groups, church groups, or what have you, even politicians. And, you know, we'll do a presentation, and that's how we get the word out as well.
Okay, we have another question here from Anne Kyoko. She says, I work with Kenyan Christian Professionals Forum. We share the same values as you, just wondering how we can work together. Brilliant work in Isiolo. I am also wondering how you manage from abroad.
Hi, Anne. I tell you what we do, Simon and all of us, we come to Kenya about at least once a quarter. We have our own staff in the hospital. So we are there, we come to Nairobi, and then we drive up to Isiolo. It's always a possibility, like we've just been talking about, that we could meet with you, we could talk to your group, and yeah, we can all function together. We can't do it alone. We need to be able to work with people, especially because the problem we're dealing with in Kenya is yours, not ours, in the sense that this is a Kenyan problem, but we've got to help all working together, because mothers matter. Mothers are the most important.
Thank you. And we have another question here from Agnes Tangwe. I am a family physician in Ottawa who did obstetrics in the past. My daughter is an obstetrical nurse who would like to do her midwifery as well. So I guess she's wondering how she could get involved with this.
We've sent volunteers over in the past, and we're always willing to accept professionals going over there and work. And what we do is we'll screen them just as if they're applying for a job, even though they're volunteering. Because, you know, it's fine for us to accept them, but they have to accept them over in Kenya as well. And there's certain rules and laws that they have to follow. You know, we want people that deal with obstetrics rather than just having a general nurse going over there that can, you know, might get in the way over there. But we're certainly open to taking volunteers, and they could certainly email us at info@matercare.org, and it's the same process as applying for a job, that we'll, you know, send your CV, send references, and we'll go through that, and then we'll start working together on how we can send you over there, how long we can send you over there. One of the biggest requirements we request of a volunteer is to go for minimum 3 months, because they're traveling so far, the expense of the flights, the accommodation there and back, and as well as, you know, if you're sending a volunteer on short term, the people over there are just getting used to you, and then next you know, they're leaving. And then they have to get used to somebody else coming in there. So we ask for a minimum 3 or 4 month commitment from nurses or doctors that are going over there. You know, it makes financial sense for us, it makes sense for them over there, and it helps everybody out.
I think what we're talking about here is a team approach with us and with our colleagues over in Kenya. They have tremendous experience. They don't often have the equipment. In many situations, they need to be upgraded. For example, in Canada here, all consultant obstetricians like me, professors of obstetrics, we have to undergo a training course every 5 years, because the skills get rusty, because you don't see all the complications that exist every day of the week. So we would like to have those kind of things organized for with our colleagues over there. And, you know, we would develop a course with our colleagues in Kenya, because obviously they have complications that we don't have, like severe anemia or malaria to deal with. So there are many things that we can develop together. And the whole idea of the project Isiolo, as we call it, is to develop a kind of a rural institute of maternal health. It's not just a kind of I don't wish to denigrate it, a mission hospital, but a center of excellence where we're providing care of the best kind in obstetrics, but also developing a treatment and rehabilitation training center for obstetric fistulae. That's when the mother is incontinent of urine feces because she has injury to her bladder because she didn't get a cesarean section. And there are very few of these centers in the world, and there are hundreds of thousands of African women who suffer this in silence. They suffer humiliation and rejection and so on. So these are the sort of things that we're trying to do a little bit different. But it's not just about Africa. We're looking at trying to look at how we can provide training programs for our own, which would be useful for African specialists in medical ethics, training online, and so on.
And Agnes just asked how could she host you there in Ottawa. So I sent everyone the email there, and Agnes, I would just say to email the office and they can organize that and see if it's possible to have a presentation there. I have another question here from Dr. Margaret Karazetzi. She says, Robert, we have many altruistic people in Rotary and other service clubs. How can I approach them for their support while remaining true to what we believe?
Well, to be quite honest, I've spoken to Rotary many times. The first time they were hugely helpful. That was in Nigeria in 81, 82, where the people there didn't want to hear about all the terrible things about maternal deaths and so on. But they wanted to know about the difficulties that we had in trying to organize a project in Nigeria. And at that time, it was communications. So I didn't know what to ask for. And one of the Rotarians got up. He said, what you need is a satellite phone. So they bought us a satellite phone in 1981-82, which cost $20,000. And it changed the whole project, created difficulties that we never expected, because most of the time we were sending letters to them and saying we want to know this, and it was taking 3 weeks, they'd answer in 2 weeks, send it back for 3 weeks. Now we were sending it instantly, saying we want this information tomorrow morning and so on. So it developed complications, but now that's gone. But yeah, Rotary could help in many ways with equipment, in providing the means of getting specialist volunteers over to Kenya and that kind of stuff.
We've worked with the Rotary Club as well. They also funded, we had donated equipment from the hospital that closed down next door that we sent all this equipment. It's very useful, very good furniture and hospital beds and all that. And the Rotary Club locally here funded to send that to Ghana. So, it's not something new working with the Rotary. It's just working with more of them.
MaterCare got the Rotary Millennium Award, which was, was something at least that was their recognition, and so they understood what we were doing, and we haven't had much contact since. But if anybody wants to organise that, we would come. And I think if we come to any place.
Good to see it. It's obviously hanging on the wall.
We'd like to do as many talks as possible to church groups, women's groups, high schools, anybody who'll listen. Anybody who'll listen.
Okay, and Stephanie Potter had another question here. Okay.
Sorry, my thing takes so long to unmute. My secondary question was, do you have any promotional materials like DVDs or pamphlets or things that I could share with, I'm involved with the Christian Medical and Dental Society as well, and other places I'd love to just be able to disseminate that information.
We've been thinking about, making contact, and because, we have much in common. Yeah, we've got all of that. Some of it is already on our website. The gentleman has put there DVDs and so on, but we
can do a package. It's very easy. We have several varieties of brochures. We have 2 DVDs. One is is more medical about obstetric fistula, and the other one is just covering what projects we've done and about MaterCare International. That's not a problem. That you can email us your address. We can do up. We can work back and forth, work between how much information you want or how many pamphlets, and we can do that up and send it off very easily. So. We
could also send you a program for the conference in Rome, where the first initiation could take place of joint, cooperation, because that's the only way we're going to succeed.
I think that's perfect. We've had some contact lately with some of the Catholic Physicians Guilds and things as well. And I know you're specifically a Catholic organization, so anything I can do to promote that. And we have a huge missionary push in CMDS, so I'd love to sort of hopefully direct some of our doctors your direction.
Well, that'd be great.
Sure, yeah, absolutely.
And Anne is just asking again, when are you coming to Kenya next? We could arrange for a meeting with my bosses. We need to drive this agenda better and make the campaign bigger. And Anne's on camera there.
Yep. Hi, Anne.
And is that okay?
Yeah.
Yep.
So when's the next plan?
I just returned from Kenya, and we have one of our project managers over there now, because we're dealing with the construction part over there. It's hard to say exactly when we're going to be over there next. It's trying to make it worthwhile going over there. If we have to cover a variety of things going over there, it's just not a matter of getting over there and just visiting. We try to cover a lot of things when we go over there, so we're very busy. Dr. Walley here might be there in June, and I'm definitely there by August, September.
Okay, so Anne, if you want to email us some contact information, then maybe once we have that travel arrangements in place, we can contact you before we go.
That's true.
And
I will email.
yeah, and she's also just given us the website there for her organization in Kenya.
Great. Yeah.
All right, great. Did anyone else have any questions before we finish up here today? Wonderful. Okay, so if anyone has any further questions or comments, they can email us at info@matercare.org. That will go straight to our office there, and we will get back to you. We do have a survey here at the end of the webinar, so once you close the window, you will be asked to complete that. If you do want to take a couple of minutes to do that, we'd really appreciate it. We hope to do these on a regular basis throughout the year, and we value your input so we can do a better job for the
This was the first one.
This was the
Thank
first
you.
one, yes. So thank you
That's
all
great.
for coming. I think it was a good
Thank you.
success. God bless everyone. Have a great
Thank
weekend.
you very much. Bye, Anne. See you in Kenya.
Okay, bye.